Oh, how many reasons can you come up with to avoid a trip to the dentist? Maybe you think you're afraid of the pain or a judgment because you haven't been in a while. None of that need be a concern with my next guest. We have doctors Annie Cordemanch with Broad and Bright, and then Diane Airbar and Aditi Savla here with Serene Smiles, as well as Broad and Bright. So we've got a lot of women who are doing a lot of dentistry at a couple of different offices. And so first, welcome to Daytime to all of you.
Thank you.
Dr. Savla, I want to start with you because they have a motto at Serene Smiles where comfort and care meet. What does that mean for you and your team? We hear things like this, but you know, it's probably a personal thing you guys all take.
Yes, we do. So a lot of people don't like coming to the dentist. It's intimidating. They're scared. So we make sure that we go out of our way to comfort them. When they walk in the door, they'll see the smiling faces of Brad or Justine at the front, Carol's at Broad and Bright, and we make sure that, you know, we try and understand exactly what they are in here for, and we tailor-make all their treatment plans for them specifically, taking their wants and needs and everything into consideration.
Because everybody is different in handling the dentist. Some people have no fears whatsoever. Right. Others have a lot of anxiety about it. So it's important. What do you think then sets you apart from other dental offices?
I think it's our treatment philosophies. To be honest, we are a group of people where it took us a while to find each other.
But it was worth it.
It was definitely worth the wait. We make sure that, you know, we're very conservative in our approach when we're trying to come up with a treatment plan. Okay. We don't want to do anything that's unnecessary. We see a lot of people that come in that have had failed treatment plans because, you know, they're always, you know, other providers are trying to do the bigger, better procedures. So we try and figure out exactly what it is that they need, and then make sure that if we can explain it to them and demonstrate it to them with our help of our, you know, cameras, our intraoral cameras, our x-rays, if I can explain it to you and I can show you exactly what you need done, if I can convince you, then and only then will you accept the treatment plan.
Will you be comfortable in accepting it?
Absolutely.
So Dr. Airbar, share with us kind of the type of care, the type of services you do provide.
Well, we treat everything from the young children to geriatrics. Interestingly enough, this week I had a patient in. She was in her late 60s, and she had teeth removed at another office and a series of adventures trying to get a denture made, and it was very unhappy for her. Mm-hmm. So she came to me and she said, "Can you make me a denture?" And I said, "Well, let me have a look." So we did, and I ended up making her another denture, and I seeded it this week and put it in her mouth. I said, "How does that feel?" And she said, she kind of scrunched up her face. She said, "Something on the left." I said, "Okay." So I took a peek in there. I said, "Oh, yes, I can see where that's rubbing." So I went back and adjusted the denture, put it in again. I said, "How's it doing now?" And she smiles real big for me, and she said, "Yeah, baby." I just love that. I like turning people where really this lady was a dental cripple, and you turned her into something that she can smile big, eat, function.
Right.
Like
that's the thing is, it's so important, obviously, to not just how we look, but how we function. I mean, we do everything with our teeth. So, and I know you guys have even heated massage chairs, headphones. I mean, you go out of your way to make people comfortable.
Yes. Well, my own family, they love me dearly, but they aren't particularly fond about sitting in a dental chair. And so I'm aware that people feel this way about coming to dentists. So we do what we can to make them feel cared for. We want to care for them. And we try to remember that at the end of every tooth is a person, and they have feelings about what's going on. And so we try to be
very well said.
Right?
Yes.
Yeah, that's interesting. So, Dr. Cordemanch, you are at Broad and Bright. They focus on kids' dentistry a lot there.
We do.
Having a 3-year-old, I understand kind of the nerves you could face with that. So, why did you decide to kind of make that your focus?
It's a totally different ballgame treating children versus adults. And to tell you the truth, kids are a lot more fun to treat, I think.
They're easier.
They're a lot easier, you know, when they're on board for it. But when they come in, especially the littlest ones, when they're scared, some of them aren't. Like you said, some people either have it or they don't. But when they come in, it's our job to just make it fun for them, make it new, exciting, especially if they're siblings. We love to see siblings together to show them that it's nothing scary.
Right.
We're their friends. We're here for them. We have snuggles in the office that they can hold on to. We talk to them. There's a method called Tell, Show, Do that we were all taught through Ohio State and through just teaching the children, and we show it to them that there's nothing scary. We come up with silly names for things, but we go through it and we just, we sing to them, we be silly with them, we have fun, but at the same time, they're learning their home care and seeing them again in 6 months. We get to see them grow up. When they're excited to come back, that's our goal. I'm a new mom as well, so I know now that I see each of these kids, I'm like, that could be my child there. And I know some of them are very scared, but some of them are excited. And we just do our best to make everybody really comfortable. We encourage the parents to come back. And in our office too, when we do have to do something like a filling or an extraction with a child, we have giggle air that we let them use. And we talk them through everything, and it's just a nice experience. We like to keep it really fun and light and give them a good smile at the end of the appointment.
Are you accepting new patients?
Yes, ma'am.
There you go. Website, phone number up on screen. Ladies, thank you so much for being with me.
Thank you so much. It's been our pleasure.